for any parents or with kids who are out swimming, doing things in the pool frequently, just, that's a great one to check for scoliosis, because you're seeing them in their bathing suits and you can kind of see if there's any change in their posture or any kind of curve looking at their spine. So it's a great time to check kids for scoliosis, especially if they're in that, those growth spurts between 11 and 16 years old. Actually, quick anecdotal story, like last year, some friends and patients were at the pool and they noticed their daughter, one hip was higher than the other. So they brought her in, and 3 weeks later, she needed to be fitted for a brace. And I would say we probably saved her because it was progressing pretty quickly. So I'm glad we caught that early. For adolescent girls, you'd want to start probably about the age of 11, definitely paying attention to it, and it can be up to their, usually they're fine, through their final growth spurts of, 16, 17, 18. Just to double check, they obviously mature faster, physically, and without question, having two boys, mentally, they certainly mature much quicker. Emotionally than the boys do. Boys probably delayed a little bit more till almost probably 13 or so. But the easy thing to check is just look at their waist. Definitely from the posterior or the back, and you can tell if one hip is getting higher than the other, and they're going to probably be leaning, or their spine is going to be crooked. You can visually see it. If it looks like it's off, then don't wait. Don't think it's, because if it starts growing, if they're getting that growth spurt and they start, for lack of a better term, warping in one direction or the other, it's important to get on that like right away, and then we could avoid any type of serious issues. Chiropractic's always good for it, but also just getting the primary care doctor involved in case they need to be braced, or wear something, especially at night when most of the changes occur, is when they're sleeping.